Today is August 2nd, 2014. We're here with Dr. Paul, who came to us. Where did you come from?
Santa Ana, I live.
Santa Ana, Southern California, because I'm having a class on ozone, oxidation, and prolozone therapy. What do you think about what you've seen so far?
Wonderful. I've been waiting a year to get to this class.
Okay.
I finally got in by chance.
And you're a medical doctor?
Yes.
Okay, what do you do?
Family practice.
Family practice, okay. And may I post this on YouTube?
Please.
You just told us you have problems with herniated discs in your neck. Can you tell us which levels?
Several levels, C4, 5, 5, 6.
C4, 5, and 5, 6.
Yes.
All right. What I want to see you do is turn your head to the right, please, as far as you can. Extremely limited. Turn it to the left, please, as far as you can. Bend it down, please, as far as you can. I'm going to come over here. And now bend it back as far as you can. Very limited in that direction, too. And last, please touch your ear to your shoulder on one side. You can't do that. And to the other side, please. You can't do that at all. Okay, thank you. And you're here for prolozone, correct?
Yes, sir.
Okay, Doc, we just did your treatment. We only got done about 20 seconds ago, right?
Yes, sir.
And what is your comment?
Oh, it's a lot better. I would say if 1 to 10, it's a 4 now.
If it started at a 10,
started at 10 right now.
It's now it's a 4.
4, yeah.
Okay, let me see you bend your head down, please.
Yes.
Bend it and turn it side to side. No, that's it. Turn it the other side. That's better. That way.
Yes.
All right, touch your ear to your shoulder. Okay, no change there. And the other side. All right, now we're going to come over here, and I want to see if you can bend your head back. And bend it down. Touch your chin to your chest, please. All right, flexion seems better. Extension is not significantly better, maybe a tiny bit, but we're just going to do you again in a little bit and see if we get any further. Is that all right?
Thank you.
You good?
This is Jason. Today is August 2nd, 2014 at an ozone workshop. You're a physician?
Naturopathic.
Naturopath from Vancouver, British Columbia.
Yep.
What happened to you today?
Well, just through the course of the day, my back started seizing. And from sitting down and not moving for the last several days, it was just tight as a rock and a lot of pain. So I volunteered to get some prolozone from Dr. Rowan, and it was a very traumatic experience. But after about a half an hour, awesome, just incredible. I have all my range of motion back.
Any pain left in your back?
There's, I feel like I've had a treatment, but there's no pain.
No pain.
And
what was your level of pain before on a scale of 10?
I would say it would probably be a 7.5, 8.
And it's now about 0 except for the injection
it's probably,
itself.
just the injection itself.
Can I see you get off the table and bend over like you did for me?
Yep. This is nowhere near what I could do an hour ago.
We heard, what did I hear?
Amazing.
Amazing.
I can't even do that, and I don't have back problems.
Okay.
I couldn't
Thank
get
you.
that way.
And you thought that was amazing too, seeing what happened, correct? Okay. And I may post this on YouTube, everybody?
Yes, you may.
Thank you.
Pain management.
This is Dr. Glenn from Loma Linda, California, and you're a medical doctor and you do physical medicine
And
pain management, right?
as well,
Pain
yes.
management.
That's correct.
I'm curious, what were your thoughts about what you saw here today?
Pretty amazing. Pretty dramatic.
Is this going to help your practice?
Absolutely. I can't wait to get going with a lot of the things I learned today.
Thank you very much. Now, we just did you.
Yes, that's correct.
We did your SI joints, right?
That's correct.
All right, and tell us very briefly what happened to your SI joints before and what happened to you now.
I co-designed a speaker that weighed 2,000 pounds. It was a $65,000 speaker about 20 years ago. I was loading it into a U-Haul, and my left leg slipped off with an 800-pound cabinet, and it ripped my left SI joint and part of my right SI joint, and actually went up into my interspinous ligaments as well. So I've had pain ever since then.
And you've also had somebody shoot ozone into one of your joints, right?
Yes, and it's actually helped a great deal. I've had traditional prolotherapy with multiple injections, and it didn't do anything close to what the prolozone did the one time that I had on the right side. Unfortunately, the left side wasn't injected, and it continued to be painful. And the right was so good, I think I overworked the left side and it injured it more. So.
And I just did your SI joints now, both sides.
Correct.
It's my practice to always do both SI joints.
Right.
And what have you noticed?
My pain levels dropped, at least on the left side, which was hurting most, from 8.2 down to 2. It's somewhere between a 1 to 2 over 10. So
Instantly.
much better. Yeah,
Very good.
very happy with
And wasn't it a surprise also? I checked the strength of a leg muscle, right?
That's correct.
I took your legs apart like this,
Right.
and then I forcibly tried to bring your foot back,
And
and you had no strength.
it was easy to do before the injections.
Before the injections,
Right.
you had no strength. It was
That's
easy
correct.
for me to bring it to the
That's
midline,
correct.
and afterwards you had full strength.
That's correct.
Did that come as a surprise too?
Very much. Very, very pleased.
Thank you. May I post this on YouTube?
Absolutely.
Thank you. Dr. Joshua, I interviewed you a couple days ago after your one-day day with me. Now you've had the oxidation workshop. Any comments after seeing this?
I'm excited to try to put this into action and see the same results that you've been getting, which are quite amazing.
You were pleased with what you learned?
Very pleased.
Were you surprised at the kind of results you saw in the office?
I was impressed with the results and shocked with the entire process.
Okay, thanks.
Thank you.
Thanks very much. This is Dr. Madeline. And
Ron Patterson.
you're from Nassau.
They're
Right.
both from Nassau.
And could you give me some comments on what you thought about your session today?
Yes, Dr. Royan, first of all, I came here today expecting this to be a normal, regular workshop. And to say that I was amazed would be incorrect. This was truly transformational. I think you are indeed a gift to humanity. I ask God to put you in His good grace and to keep you strong, healthy for a very long time.
Thank you.
Thank you very much.
Thank you.
Well, Dr. Rowan, it took me an entire day to travel here, and it was truly worth it. I mean, this has been a most exhilarating experience. In fact, I've been in medicine for quite a while and practicing conventional medicine, and I now feel like a new door has opened in my professional life, and I'm really looking forward to being able to put some of this that I've seen and learned into practice, and you're doing a tremendous work, obviously very gifted. And I think the patients that we were able to see that were treated are truly, truly benefited by whatever it was that you did, and they're very grateful.
Were you
I'd be
surprised
happy-
at what you saw?
Absolutely, positively surprised. Yes, of course you think, well, maybe there'll be something kinda, but to see the physical differences between somebody unable to raise their arm, for example, being able to do so, somebody barely coming in with a walker, being able after treatment to jump off the bed and walk around and be happy. It's truly rewarding, and I'm very, very glad I came. And I look forward to some more oxidative therapy.
Thank you. I may post this on YouTube?
Yes, of course. Yeah.
Absolutely.
Thank you.
Thank you indeed.
Thank you so much for
It's an
having me.
honor that the two of you came all the way from the Bahamas. Thank you very much.
Thank you for having us.
Hi, my name is Robin. I'm a doctor of oriental medicine for actually 22 years, and I've been doing oxidative therapies for 13. This is my second time that I've come to Dr. Rowan's intensive class, which I think is like a mastermind for oxidative therapy. Even the second time around, I learned so much, and I do this full time in my practice, but just to be around other doctors, to again see the genius of the work that you're doing, Dr. Rowan, and thank you too for the gift of bringing this to humanity, because I can't imagine how many unnecessary suffering, how much unnecessary suffering is going on out there on a day-to-day basis, all these unnecessary surgeries, and we're helping to change the face of healthcare by practicing these therapies. So thanks for introducing it to all of us and all these incredible doctors from around the world. It's always inspiring for me to be in the field of so many amazing people that you gather here.
Thank you. This is Mary, who is a nurse practitioner who came all the way to see us from
Maine.
Maine. What did you think of today?
It was an amazing day. It was like miracles, one right after the other, including myself.
What happened to you?
I think it was a Baker cyst. We don't know what was wrong with my left knee, but it was difficult to bend, and it's been bothering me for a couple months, and it's completely gone in just that one treatment. We'll
One
see how long it
session.
lasts. Yes.
Okay, you'll have to let me know, right?
I'd love to.
Okay. Will you be able to use this to help your patients?
Absolutely. I treat a lot of Lyme and
Wow. Would you recommend this type of training to other doctors?
absolutely. I wish the other two in my office would come.
Okay.
We'll
Thank
see.
you. May I post you on YouTube?
Sure.
Thanks.
Start again. Take two.
Go ahead.
Hi, I'm Tom. I'm Robin's clinical assistant from Santa Fe, New Mexico. There at the clinic, I set up and maintain the IV therapies, the oxidative therapies that we perform there. Some of which that we got some different perspectives on here. Dr. Rowan's office. It's been fantastic. Learned a lot of little techniques, little tricks that we hadn't thought of in terms of doing things a little differently and possibly in adding some new therapies.
What were your thoughts on what you saw today with the patients?
Fantastic. We obviously see a lot of the same things in terms of our applications with regard to prolozone and UVBIs. Had never done major autohemotherapy, so that was really fantastic to see that. That was one of the reasons why Robin came back and wanted me to see that was to experience that because of the sheer potency of the major autohemotherapy unit. And then just some of the different ways of administering injection techniques, which we hadn't necessarily either thought of or utilized. So that's what I'm taking away.
Thank you. I may post this?
Absolutely.
This is Valerie, and Valerie came all the way from
New
Florida.
Smyrna Beach, Florida.
Valerie's a physician. What kind of physician are you?
I'm a dermatologic surgeon and dermatologist, and I also practice integrative medicine and energy medicine. I just finished the most amazing day learning about oxidative therapy. Dr. Rowan worked tirelessly all day, showing us many ways to get ozone into the body, UV blood, and worked tirelessly injecting so many joints on so many of the participants. He is so committed to alleviating suffering and humanity, and so committed to making sure every single one of the course participants had everything they needed to be able to go home and treat their patients. It was just an amazing opportunity, and I can't say enough. Come take the course. You'll be glad you did.
Thank you. Let me ask you this as far as the patients. What did you think of the results you saw in your own colleagues, let alone the patients?
Most of my colleagues had an amazing difference in pain and range of motion. One fellow was able to put both palms on the floor. He had back pain when he started, and when he was finished, he could bend over with both palms on the floor. I saw people with shoulder pain able to raise their arms over their heads. Patients and colleagues both saw amazing differences afterwards.
Was it shocking to you to see
It
those kind of
was
results?
shocking, and so quickly. I mean, some of them were within 2 minutes of finishing the treatment. They just stood up and felt better. Amazing.
Okay, I hope it's something you'll take up too.
Thank you.
Thank you very much for what you said.